This is the PA Startup Podcast, episode number 26. This is the PA Startup Podcast, where we help pre-PA students, current PA students, and new grads start their careers as physician assistants. I'm your host, Chris Darst. We are glad you're here. Hey guys, welcome to the PA Startup Podcast. This is a weird episode. I apologize for any audio quality issues. I'm actually driving in the car right now, and it's a bit windy. I normally do these from my basement, from our game closet, actually, is where we put all the board games and stuffed animals and stuff. But I am driving to the airport and thought I would put this up real quick. I'm a little late. I think that for all of you pre-PA students and current PA students, it's important to have kind of direction. And a big part of that is, what is your purpose behind pursuing the PA profession? I gave a talk some months ago at a leadership conference about finding purpose. And so I want to share that with you today, because why you become a PA is essential. Number one, to know what it is, and number two, to identify it and keep that, forward momentum towards becoming a PA. If you have a solid purpose, then the hard times are manageable. They're still hard, but they're manageable. If you don't have a solid purpose, or maybe you don't know what your purpose is, that's okay, but it's going to make those harder times, you're going to wonder if it's worth it or not. So let me tell you my story real quick, and then at the end, I've got a challenge right back to you, okay? So I grew up in a medical family. My dad's a doctor, my brother's a doctor. I saw healthcare. I loved medicine, but I wasn't entirely sold on the job of a doctor. Some of it was the training. I had thought about med school. I was kind of interested in orthopedics back then. And so I thought, if I were to go to med school now and become an orthopedic surgeon, my new baby would be 14 before I was done and in practice. And I was not really sure that's how I wanted to spend her childhood, was in training. So the PA profession was a great fit because it was short, relatively, compared to that, and it taught me what I wanted to know, and it put me in an environment that I wanted to be in. So it was great, but I didn't know what my purpose was, because it wasn't to be a doctor, obviously, because I didn't go to med school. And I would warn you, if your purpose is, I want to be a doctor, but I didn't get in, don't go to PA school. Please don't, because you're never going to be satisfied. If you say, I want to be like a doctor, that's actually, honestly, guys, it's not good motivation. You should be a PA because you want to be a PA, for whatever your reasoning is. I want to help people. I want to be involved in cancer care. I want to, whatever it is, that's good motivation. But wanting to be a doctor or wanting to be like a doctor is not good. But I wasn't really sure what mine was. And I remember the first time in school, I had my stethoscope around my neck. We were doing practice physical exams or something. And I was standing there with the stethoscope around my neck. And I thought, man, I feel really cool right now. But I felt like a fraud. And I wasn't really sure why. And it was because I didn't have a clearly defined purpose. So anyways, fast forward a month and a half into PA school, we had our first baby. We went to childbirth education classes. We went to all these, the stuff you're supposed to do when you're having your first kid. And we were told this is how it's going to go and this is what to expect. And her delivery was anything but that. She had what's called a cord prolapse, which is where the umbilical cord gets pinched between the baby's head and the mom's pelvis. And so effectively, it was like holding her breath. She's not getting blood flow, so she's not getting oxygen, which can cause brain injuries and all kinds of stuff, strokes. It's a bad deal. And so it went from something's weird, something's not right. Her heart rate was dropping, and we thought it was the monitor. We couldn't figure it out. But finally, a wonderful, wonderful nurse figured out what was going on and sounded the alarms. People came out of the woodwork. Pretty soon, my wife's being wheeled off for an emergency C-section. I'm giving consent forms to sign. They're telling me to put on scrubs. And like an idiot who didn't understand the situation at all, I was like, I'm going to get to see surgery. This is going to be super cool. I did not appreciate how serious this was. So I get into the operating room, and the scalpel is going across her belly. And I look over the drape, and I'm like, whoa, that's crazy. And I look down at my wife, and she has this look on her face, terror. And I thought, that's what's going on. And she mouths the words to me, "I can feel it." And I thought, there is no way that she can feel this. And I look at the anesthesiologist, and he kind of shakes his head and he goes, "I'm sorry, the epidural got contaminated. We couldn't put anything through the epidural. I'm sorry. And I can't put her to sleep because then the baby's heart rate could go lower." And I look over the drape at the surgeon, the OB, and she goes, "I'm so sorry. I have to get this baby out." And I realized then, after the knife has already gone through, as they're working, they're numbing her up with some local lidocaine or, Marcaine or something like that after the fact. So she's already been cut and can feel all of it. So it was horrendous. Her blood pressure was dropping. She was throwing up. I mean, it was a horrible situation. But I thought, if we can just get this baby out, we'll put this behind us. We're going to get through this. And I had always pictured my daughter coming out pink and shriveled up and crying and stuff like that. But what they brought out was not that. They brought out this gray, limp, and silent baby. And they took her over to the warmer and they start working on her. And there's a test called the APGAR test, and you get 0, 1, or 2 points in 5 categories. The max is 10. Most babies have APGAR scores of 8, 9, or 10 or something like that. And they do it at birth, at 1 minute, and at 10 minutes, I think. Or maybe it's 5 minutes and 10 minutes. Hers were 1, 1, and 2, which is like horrible. And she's not looking good. My wife is not good. I don't know where to go. I was just lost. And the doctor was like, "I need to put your wife back together. You go be with your baby." And so I stand next to the baby for a little bit. No one's making eye contact with me. Super awkward. And finally somebody was like, "Hey, the pediatrician's here. You really need to go talk to him." So I go talk to him, and I had just met him like once before, and he was like, "Dude, this is a bad situation." And he used some words that I don't want to use on the podcast, but this is a really bad situation. And he was like, "Listen," he's like, we're gonna take it one hour at a time. If we can get an hour without a seizure, that'll be a good thing. And let's just see if she can get to 24 hours. And I was like, oh my goodness, like this is a serious problem. Another test that they do is their pH, and pH is 7.45 is normal. And like 7.2 is getting pretty acidotic. 7.0 is a really big deal. My daughter's at birth was 6.8. So super acidotic, which means she's at super high risk for a ton of complications, basically. So they were worried that she had a stroke. They were worried that she had a brain injury. It was no good. So I spend the next hour or so kind of going from the nursery where they're working on my daughter and I can watch her actively seizing, which is not good, and going to the recovery room where my wife is trying to wake up from surgery. And when she wakes up, I was like, "Hey, our daughter, she's here. Like, let's forget about what just happened." And I tried to show her a picture, and my wife was like, "I can't see her because if I see her, it'll make it so much harder because I'm not sure she's going to live." And I don't blame her. I mean, it was a difficult situation. So the next 24 hours, basically, I spend going back and forth between my wife's room and the nursery. Now, the nursery, no one wants to make eye contact with me because if they do, I might ask them a question that they can't answer, which is my baby going to be okay? So I don't blame them at all. But I didn't want to be in my wife's hospital room because she's having like PTSD, flashbacks to it. She's crying. She's super emotional. She doesn't want to talk about the baby. She doesn't want to talk about anything. I'm lost. I have no idea what to do. And I kept trying to get her to go to the nursery. She didn't want to go to the nursery. I kept trying to get the baby to come into our room, but they wouldn't let her out of the nursery at all. So I was kind of stuck. So about 24 hours after she was born, this is probably like 11:30 at night maybe, there's a knock at the door. And a nurse comes in who I had known. I had worked at the same hospital as a phlebotomist for several years. She was kind of my go-to for questions about, pregnancy and stuff like that. And she's like, "Hey, Chris, do you have any clothes for Paisley?" That's my oldest daughter's name. And I was like, "Yeah, why?" And she's like, "Well, she's actually kind of too fat to fit into ours." And I swung around like, I don't know if you noticed right now, but we're going through something, and this is hardly the time to fat shame my baby. But by the time I looked at her, she started laughing, and I kind of started laughing. So I pulled like some pajamas out of our bag, and I gave it to her. And she left, and I was like, that's interesting. Like, no one's actually called her by her name. Like, I named her immediately. I said her name's Paisley, and no one had called her that. They kept calling her the baby or your daughter. They never called her by her name. So I thought it was kind of cool to hear her name. So a couple minutes later, there's a knock at the door again, and that same nurse comes in, but this time she wheels Paisley in. She's like, guys, I'm not supposed to keep her out of the nursery, so I can't keep her in her for too long, but she is so cute in these pajamas. You have got to see her. And she scoops her up and plops her right down in my wife's arms. And in that moment, everything was going to be fine. We were ready to fight however we needed to for this girl, whether that was, a lifelong commitment to, doctor's appointments and health issues and her having cerebral palsy and being in a wheelchair. And like, we didn't care. We were like so absolutely in love with this baby. And 10 minutes before, if you would have asked my wife, like, do you want to see the baby? She would have been like, no, I do not want to see that baby. We got to get a couple more days under our belt before I can stand to see her. But now it was done. Like, my wife was head over heels in love, did not want to let her go. And so the nurse is like, hey, where's your camera? This is back in the days before cell phone cameras. I'm sure just in my defense, I'm sure they had cell phone cameras, just no one used them because they were like half a megapixel. But she's like, where's your camera? I want to take a family picture. And so I give her my camera, and we like pose for the picture. And while she's taking the picture, and I will put it in the show notes because it's a cute picture. I had just a touch more hair, not much, but super cute picture. But it is the actual picture that I'm talking about. So if you go to pastartup.co/episode 26, it'll be on there. But as she's taking the picture, I realize everything that just happened. And what happened was she called Paisley by her name. She brought her in and put her in my wife's arms, even though she knew that my wife was like skeptical about meeting the baby. And then she called us a family. And all three of those things made such a huge difference. And what's interesting, guys, as you are either going to school or in school or maybe newly graduated, it didn't require knowing medications and dosages. It didn't require writing the right order. It didn't require a progress note. It didn't require a sample. It didn't require anything. It required seeing a need and responding to it. And I thought to myself, as she's taking the picture, that is the provider that I want to be. I want to be that one. I want to be the one that identifies the needs of people, and I want to respond to them. So, of course, I want to take good care of my patients. I want to practice good medicine. But my purpose for coming to work every day is to look for those needs. And it was a nurse that showed me that. It wasn't a PA. It wasn't a doctor. It was a nurse who's in the trenches every single day who, like, nailed it. We still adore this nurse. We don't see her as much as we'd like to, but she's amazing. And it was because of that event right there. So I've already gone on too long, but so that was my purpose. So I was like, that's my purpose. That's who I'm going to be. So fast forward 2 years, we have another baby. Why? Because the first one went so easy, right? Not really. We have a second baby, and this time delivery goes great. No problem. We walk into the operating room, put the epidural in, she lays down, planned C-section, everything's great. Hospital stays amazing, no trouble. So we get home, and my wife is short of breath. She's like, hey, I'm kind of having trouble breathing. And I was like, it's just postpartum blues. Oh, you're just anxious. Oh, you're just worried. Oh, you're just stressed. I gave every excuse I could. Now, at this point, I am 9 months from graduating PA school, okay? So I know more than I did the first time, but I don't know a lot yet. I have a good, broad understanding of some things, but I don't know a lot at this point. I had just started rotations. I think I had done family practice, maybe psych or something like that, but hadn't done a ton. Anyways, so she's short of breath, and I look at her legs, and I don't see any signs of blood clots or anything like that. So I would call the doctor, and the doctor's like, hey, listen, I'm not there. You got to use your judgment. And I was like, she's fine. She's just a hypochondriac. It's not a big deal. So the day goes on. She gets more and more short of breath. And so finally, my parents come over to visit, and we're talking and stuff. And she goes back into the bedroom with the new baby, and she calls me back in there. And she's like, Chris, something is wrong. Like, we need to go to the hospital. And I was like, if we go to the hospital, like, they're going to think I'm dumb. And, I gave all these excuses, but I say, fine, let's go. So we go to the hospital, they draw some blood, they do a couple different tests, and they're all negative. But the ER doctor said, hey, I'd really like to do a CT scan of her chest to look for a blood clot. And I was like, her legs look fine. Like, the Dopplers of her legs were fine. Everything's fine. I don't think she's got a blood clot. And she goes, I really need to do this. And I was like, okay, whatever. So she goes off to CT. She comes back. We're just chit-chatting. The doctor comes in, and she goes, guys, I'm so sorry, but your wife had a pulmonary embolus, which is a blood clot in the lung. And I was like, oh my goodness. And my wife looks at me and sees the look on my face, and she goes, what's wrong? And I was like, that's a blood clot in your lung. And she goes, is that serious? And at this point, what I knew about PEs was they could be fatal. And I was like, that's a big deal. And she goes, am I going to die? And I was like, I don't know. And so she's, emotional, and we've got this 5-day-old baby or whatever it was, 4 days old. And so they are like, well, we're going to admit her. We're going to do some other tests. We'll keep an eye on her. And at this point, I still had no idea, like, how big is it? Where is it? Now that I've been in practice for a while, I have no better questions to ask. But at this point, I had no clue. So we get upstairs, and of course, it's like the middle of the night by this point. And my wife was like, hey, I don't want to die alone. And I was like, I don't want you to die, obviously, but I also don't want you to die alone. And she's like, will you stay with me? And I was like, of course. Because I had the baby, and she needed to, nurse the baby and stuff. So I was like, sure. And I talked to the nurse, and they said, yeah, you can stay. So I am sitting in this chair, holding the baby, putting the baby to sleep. And my wife was like, hey, if I die, like, I love you. And, we went through all that stuff. And I was like, oh my gosh, like, this is such a huge deal. I can't even wrap my mind around it. And I said, listen, I'm going to stay up all night and watch you sleep so that you're comfortable and you don't die alone if you were to die. And so she is like, okay. So, like, she goes to sleep, and I don't know what I'm waiting for. Like, am I waiting for her to stop breathing? What happens? So it's like, now, fast forward a couple hours, it's like 2:30 in the morning, and I'm trying to stay awake. So I go out to the nurse's station to get something to drink, and there's a doctor sitting out there that I had met. I kind of knew him from rotations and things. And he's like, hey, what are you doing here? And I was like, oh, my wife's in this room over here. She had a PE. And he's like, oh, no way. He goes, I thought that her name looked familiar. I'm actually on with the hospitalist service overnight. I'm just checking out her chart. And I was like, oh, man, hey, is she going to be okay? And he was like, well. And so he starts flipping through the chart. And he's like, yeah, she's going to be all right. And I was like, how do you know? And he's like, what do you know about blood clots? And I was like, I don't really know anything about blood clots other than a PE. It can be fatal. And he's like, yeah, they can be. He's like, but she's on all the right medicine. Like, she's going to be okay. And I was like, how do you know more isn't going to break off? What's the story here? And he's like, how much do you know about blood clots? And I was like, not really anything. And he's like, hey, do you know who John D. Rockefeller is? And I thought to myself, yeah, I mean, I'm aware of him. I know his name, and I know he did something, but this is hardly the time for a history lesson. And he said, so he used to raise just crazy amounts of money for his time, for, when he lived. And the way he would do it is he would invite all these rich people to a board meeting, basically, where he'd present this new idea. And at the very end of the meeting, he'd ask for money. But what they didn't know was prior to the meeting, I guess he was a big smoker, and he'd smoke these super long cigars. And before the meeting, he would put a wire down the center of the cigar. So as he's talking and as he's smoking this cigar, the ash is building up on this cigar, and it's getting longer and longer and longer, but it doesn't fall because this wire is in the middle of it. And he was, a great presenter, and so he's using his hands and he's waving his arms all around, and the ash just never falls. And people would get so mesmerized by this that by the time he got to the end of his presentation and he's like, okay, so pull out your checkbooks and give me, $10,000. They were so distracted that they would be like, okay, and they just go ahead and do it. And he's telling me this story, and I am completely engaged in this story. I am like on the edge of my seat. So he gets to the end of the story, and he said, the medicine is stabilizing this just like the wire was. And it made perfect sense. With that story that I still remember, like every word today, and that was now 12 years ago, I understood it. Like, he didn't use any fancy biochemical terms. He didn't talk about, low molecular weight heparin versus, heparin. He didn't talk about the clotting cascade. He didn't talk about any of that stuff. He told me a story that I could relate to on my level, and it completely explained the situation. So I thought, as he's telling me this, I was like, oh my goodness, I see what you did here. This is awesome. Like, you used an analogy or you used a story to explain a complex medical situation in terms that I can understand. Now, could I pass boards based on his explanation? Of course not. But I didn't need to. I needed to go in and tell my wife that she's going to be fine. I needed to know for myself that she's going to be fine. I didn't need to know necessarily all the nitty-gritty of why. But I thought, now that's the kind of provider I want to be. I want to be that guy who can explain something in terms a patient can understand. And then I've got a problem, because I want to be two people. I want to be the one that identifies the need and responds to it. And I also want to be the person that can explain things in terms that people can understand without making them feel dumb. And I realized I don't have to pick. I can do both of those things. I can incorporate both of those into my daily practice as a PA. And that's what gets me going. I get made fun of sometimes because I take a little bit of time with patients when I go around on them or something, because we get to talking or I get to explaining something. And clearly, as you can look at the time of this podcast, I'm a talker. So, but that's my calling. Like, that's what I do. And that's my purpose. Like, I love my job. I love what I get to do. But the why, the reason I do it is because I have this purpose driving me. And ultimately, my ultimate purpose is to provide for my family. But the way I do it, like the method to my purpose, is by explaining things and looking for those needs that need addressed. So here's my challenge to you then, and thanks for sticking with me with all of this. My challenge to you is, if you know your purpose, remind yourself of it daily. Whatever it is, put it on a Post-it note, put a reminder in your phone to go off at 7 a.m. every day. Put something, on your mirror when you're brushing your teeth. Put something on your computer when you get to work, like whatever. Put something on your laptop when you get to the library. You open it up, and this is why I'm studying. This is what I want to be. And remind yourself of that. Now, for those of you who don't have a purpose, don't worry, because you are surrounded by people pretty much at all times that have amazing talents and gifts, whether that's a student in your PA class, whether it's someone at your job. If you're like me, you're a phlebotomist, you're surrounded by other people who are working towards something. Like, you can look at what you admire of those people, like how someone explains something. I could look at that and be like, wow, I want to be that guy. Or someone who's like technically really proficient. I want to be like that guy. Just steal someone else's. Well, it's not stealing. Borrow someone else's. Borrow their purpose, or borrow something that you appreciate about them and make it your own. And if ultimately that isn't where you end up, that isn't what you want to do, that's totally fine. But that can be your purpose. That can be your driving force. So, guys, sorry, this has been super long-winded. I'm just on a long drive, and, I got some time to kill. But I want you to start this year and start your continued pursuit of PA school with a clear purpose. Because when you get bad news, let's say you don't get in, that purpose is what drives you to keep grinding away at your goal. If you do get in, congrats, but you still have hard work ahead of you. You've got tests and quizzes and presentations and all kinds of stuff, and the material's flying at you at warp speed, and you got to stay motivated. And it's that purpose that does that. If you're out practicing and you've had a bad day, or you've had a ton of charts, or you've got, you're trying to get up to speed on everything and you're overwhelmed, it's that purpose that keeps you going. So guys, that's it for me. I've taken too much of your time already, so thank you for listening. If you want to support the PA Startup Podcast, of course, you can go to pastartup.co/audible. You can sign up for a free 30-day Audible trial. They give you a book of your choice, which is really cool. And you can cancel at any time before that month's over. It's completely free to you, but it does help keep the podcast going. I've got some exciting episodes coming up. I won't commit myself to a time frame, as we've talked before. Sometimes I get a little flighty, but I've got some great interviews coming up, and I hope you'll bookmark us, subscribe to the podcast if you haven't already, so that way new episodes are delivered to your device. For those of you pre-PA applicants, CASPA is going to open here in a couple months, so we'll be talking a little bit more about that coming up. And hey, I'm just excited for you guys. I'm re-energized by even reflecting on my purpose. I could do a better job of doing this every day, of reminding myself this every day. But I hope you are too. So thanks for listening. Thanks for your time. And we'll catch you on another podcast in the future. All right, guys, take care.